real power of working directly with health systems in general is bidirectional. Number one, we as a virtual care platform can really utilize our data to move women from a point of wanting just pure education around what's going on in their body. Menopause is something women are not educated on, to action, to seeking treatment. Thank you. It's good to be back for sure. Gennev, we just continue to support more women in their healthcare through menopause. Just a refresher, Gennev is a health platform for menopause treatment. And over the last 12 months, we've really been able to put an efficacy claim out there. 94% of our patients report an improvement in their symptom relief after working with Gennev. And this is an achievement from the aspect that menopause is really a journey versus a day. The problem that we're trying to solve for is that the treatment that a woman needs is addressing any combination of these symptoms you see in these bubbles on the slide at any given point along this 20-year journey between perimenopause, menopause, which is 1 day, 12 months since her last menstrual cycle, and then obviously in her postmenopausal years. Her health and the combination of symptoms she's experiencing, whether it's mood changes or insomnia or hot flashes or brain fog, the combination of these things shift as her hormones shift, making the kind of treatment model, it requires personalization as well as integration. It's not just a single point solution way of addressing this part of women's health. How we've approached this is, number one, we're raising the standard of care with proven outcomes around menopause care. As I mentioned, 94% efficacy of patients report symptom improvement. And we're doing that in 4 key ways. Number one, we're starting with personal health data. Our menopause assessment, we now have 200,000 women who have taken this assessment. It answers 2 key questions. Am I in menopause? And how long am I going to be in it? Or where am I at in that 20-year journey? From there, we have enough data where we can start to guide her towards the treatment of choice. We really direct women to work with our doctor network. Typically, physicians don't receive any menopause education. And our team of clinicians, which are all OBGYNs, they're North American menopause certified, and they've gone through our protocols, is an incredible resource for women, and they're specialists. They're value added on top of her existing physician. From there, they have a 3-point treatment solution set that includes prescription, commonly HRT, CBT programs led by our health coaches, and of course, over-the-counter products for immediate symptom relief, lubricants, supplements. Finally, number 4, we're measuring outcomes in terms of adherence with 3 to 6 month checkups. Currently, this is managed through a provider, patient coordinator team, and over time, we'll look to automate that in our app. Our integrated program is really, and platform is creating a flywheel effect. 200,000 assessments are personalizing our care. We've seen 6,000 patients nationally over the last year. It's 200% growth year on year. 62% have attached prescription programs and products, and 72% are coming back time and again. Our team is seasoned in terms of really delivering a data-backed solution for menopause treatment. My background is Microsoft. I spent 15 years there prior to starting Gennev. Our chief medical officer comes from Penn Medicine. Our CTO from Amazon, he's a data scientist where he built the frequently bought together capability and technology, and he's bringing those data insights into our application to further use personalized health data to mass treat women in menopause care. Now, to date, we've grown the business very much. We've worked hard direct to consumer to build our database of women so that we can intelligently scale our model. Over time, phase 2, and we're raising funds to do this, we're starting to secure enterprise referral partnerships. We started an early relationship with CVS Health Hubs. We're in 550 health hubs with products on shelf and pop-up clinics coming on the way. We're working with EHIR to get into the workplace and support women there. And we're starting early work with health systems, Providence being one of those. We're currently raising a Series A $10 million round, and that's really going to scale this model through technology, expand our healthcare treatment team. We have national coverage today, but we know that demand continues to grow, and of course, to invest in our growth channels. With that, I will take questions. We would love to have anyone interested in joining this Series A. We're starting to take requests for leads, and I'd love to open it up for questions. To date, we started direct to consumer to prove out the model. And through that, we've seen 200,000 women take our assessment and result in 6,000 patients in the last year. From there, we want to move into really enterprise places where the intention and for women going to acquire their healthcare is high, whether that be retail health for your clinic around the corner, whether that be your healthcare provider and health system, or your workplace. And so we've really started to lay the groundwork for what will be partnership work in this next 12 to 24 months. And then we'll really shift towards a B2B model as we bring in insurance reimbursement to really drive our solution growth through workplaces and health systems. I think the real power of working directly with health systems in general is bi-directional. Number one, we as a virtual care platform can really utilize our data to move women from a point of wanting just pure education around what's going on in their body. Menopause is something women are not educated on, to action, to seeking treatment. And that's the power and the beauty of what our model does with both our data as well as with our telehealth providers, if that's additive to the healthcare system. From there, a relationship with the health system for last mile treatment where we can't solve that around examinations, procedures, laboratory work. That's where we really need on-premise healthcare systems to take that patient into the last mile of her care. And so it's really a symbiotic relationship that we're working with health systems like Providence to build. The common thing that holds women back from their own healthcare, typically in the healthcare system, after a woman has a baby to when she's elderly and has more chronic health issues, there's this huge desert where her healthcare is really kind of left in a lurch because there's no direction. We want to fill that in terms of being this post-reproductive care place. And what leads her through that journey is having an understanding of where she's at in it. And so we're using that data to drive her from being early educated around her menopause all the way through to what are the options and solutions she can not only have for symptom relief to feel better during this time of life, but then also how does her treatment now impact her long-term health outcomes around heart disease, bone health, and dementia and Alzheimer's, three things that are directly correlated to how a woman treats her health during menopause. We think data is really powerful in moving women through that decision matrix, and that's really why we've built our platform on that.